I've been very surprised with the interest and the excitement of the people that have attended this meeting, particularly regarding the thoughts on how to develop and generate new ideas. And this is not related to the country. And I think that we can assume that we have a worldwide oncologist level of a very high value that we can use to generate ideas, and that the ideas is really not related to a country itself or the level of the country. And I think that we can expect in the future that many clinicians worldwide could come to the world of the investigators-initiated trial as developers, not as recruiters, and that's great.
Well, I think that first of all, I would like to highlight the importance of developing research. I think that when we are physicians, the primary objective is to do all our best for our patients. But sometimes we do not realize that we will be unable to cure our patients, basically when they become metastases. So one of our tasks, when our duty is that we have to improve what we are doing in daily practice. And the only way to do that is based on clinical research. So I think it's great, it's fantastic, it's amazing when you have the opportunity to develop ideas that at the end will help our patients to live longer and to live better. And the only way to do that is when you are involved in good groups, in good research, in good strategy-based proposals. So I think that the best way to do this is when you have the opportunity to interact with mentors, with different people across the globe, with the same interests, with the same objective. Unfortunately, this is something that we do not learn in the universities, and we do not learn in many hospitals. So we need networks, and we need think tank meetings to do these aspects to improve our, basically, what we do is to do better medicine. So I would encourage young oncologists, and not always young oncologists, to look for this type of think tank meetings and to be part of them. It's always a tricky question because there were so many things that it's difficult to select one or two. But first of all, I would start, Tony, if you don't mind. Maybe I would say that, being with our friends, our colleagues in this friendship environment, So when people leave to their countries, they really say that this is like a family. We have been working so closely, so happy, so in a friendly environment that this is just amazing. Afterwards, we have developed great projects that hopefully, at least some of them, could be good enough to be approved by the pharma companies. So I think I would say two things: the friendship of the microenvironment, and the way to interact with our friends, with our colleagues. We learn from each other. I think that we have learned more from the attendees than from us.
Yeah, I think that honestly, we have had very high level discussion, not far from what we observe in advisory boards with key opinion leaders. It's true that we are several key opinion leaders with other people, but finally the discussion that we have had, this backstage of clinical research, is crucial for people because some of them will be the key opinion leader in a few years. And we want to promote that. Not just we want to promote science, clinical trials, we want to promote people able to think out of the box, trying to generate what will be the future clinical trial design in order to answer faster and better the clinical question that we have in practice day by day. And that has been great.
So we can have good time, enjoyable, and we can develop good ideas. So all in a one, I think this is the best way to move forward.